So I've come from a place, Memphis, Tennessee, where there was a huge socioeconomic disadvantage for patients, not only from an access perspective, but also just even if they get access, their demographic doesn't even allow them to go see the doctor because so many people work hourly jobs. They can't take off at 3 o'clock in the afternoon to go get a mammogram, or take off 3 weeks to go get chemotherapy. They can't afford that, or how do they do that? So how does community oncology work with that? One is community oncology has got to collaborate with navigators to make sure that those families are taken care of, and that, I mean, we have, it's a horrible term, a lay navigator. They're not clinical navigators. Their sole role is arranging transportation, childcare, food, all of that, so patients can actually access and stay in the system, and they're not confronted with those barriers. The other piece about health inequalities is really affording it, right? Community oncologists give a lot of free care. The tough part is paying for the drugs or some of the systems that they can't necessarily control. There is a lot of success in matching patients to foundations, to drug replacement, and working with neighboring hospitals to try and figure out how to give that care through some of their programs. And to me, that's why everybody has good relationships with everybody. You can keep those things going. The last thing I'll say about that is Memphis, Tennessee used to be the #1 disparity place for a African American woman versus a Caucasian woman in breast cancer. In other words, an African American woman was twice as likely to die from breast cancer than a Caucasian. And study after study showed that it wasn't due to access. It was due to the ability for them to actually present themselves at a site. And when I say access, I mean it wasn't because they couldn't find a place that would give them free care, and it wasn't because they couldn't find a place that would treat them. It was because their culture of working hourly or taking care of the family at home prevented them from getting treatment. And so we actually moved that at West Cancer Center, which is a founding practice of OneOncology, from #1 to #9. How did we do that? Community outreach, these lay navigators, navigation, and providing hours outside of the normal business hours, Saturday, late hours. And those are the kinds of things that I think community oncology can really do to help solve the inequalities with some oncology care.